Welcome to another interesting package of the program. CSR Digest is part of feedback mechanism put together by Total Exploration and Production Nigeria Limited to look into some of its corporate social responsibilities to host and neighboring communities. Today we are looking at the mass-free health program held in Erema, in Mandoni local government area, where thousands of people benefited from the mass-free health. Join me as we go to Erema for this program. According to Mr. Lecoq, Total's corporate plan of action on health is predicated on the slogan that a healthy people make a healthy nation. He maintained that the company has continuously championed health-related issues through various programs such as Healthy Living Awareness Campaign, Safe Motherhood Program, HIV Awareness Campaign, as well as capacity building for staff of primary health care centers, among others. Represented by the Community Affairs Manager Offshore and Port Harcourt, Okechukwu Obara, the Deputy Managing Director expressed optimism that at the end of the free health program, more than 5,000 people would have benefited from it, and enjoined residents to avail themselves of the program to improve their health.
We believe that this project has helped a lot of individuals and families who could not afford healthcare costs in our private clinics, against the backdrop of the current financial challenges facing public hospitals and sectors across the state.
Facilitator of the program and Director, Medical Missions Manifield, Nigeria, Dr. Akubike Okara, commended Total Exploration and Production Nigeria Limited for its policies on health and appealed for sustenance. He assured of his mission's capacity to deliver on its mandate and called on other multinationals to emulate.
Their medical program is one of the fantastic ones I have ever seen. Currently, they are running a 2-week free medical program for the OML 58 communities. And the patients are still coming. We have 2 weeks to stay. They are responding. That is why we have attended to over 800 of them on the 3rd day of the program. And we are expecting to attend to about 5,000 patients before the end of the program.
Chairman, CDC Erema Ben Chilekwe, a community leader Chief Jonathan Wobidi, Total's vendor High Chief Isaac Obulo, and Chairperson Oil and Gas Women lauded Total EMP's corporate social responsibility to its host communities and expressed the hope that it will continue. Beneficiaries thanked Total EMP for the gesture and sued for support of stakeholders to enable it thrive.
On Total for making it possible for me to have this year's free, because there is no money for us to pay in the hospital.
Tested the kind of eyeglass that we use, and they gave it to me.
Total, God will bless all of them. They won't have problem.
The mass-free health program continues. Welcome to the discussion segment of CSR Digest. CSR Digest, as you all know, is a program put together by Total Exploration and Production Nigeria Limited to look into some of its corporate social responsibilities to its host communities and some neighbors. And we are here today to discuss the issues of OML 58 Mass Free Health Program that was held some time ago. And of course the facilitator is here to, give us some of the details of the program and the challenges, the prospects, and the advice you have for Total EMP and those who have received medication. You're welcome to CSR Digest, Dr. Akubike Okara. Welcome to CSR Digest. Yeah, as the facilitator of the program that was held just a few days ago in OML 58. In your speech, you recorded the fact that over 5,000 people will benefit. In the whole of this, how do you look at that program? What were your challenges? How were you able to surmount these challenges to come out with a robust health program that has just ended? How do you look at that? But first, let's meet Dr. Okara personally.
Yes, thank you very much for inviting me to this program. My name is Dr. Akubike Okara. I am the Managing Director of Partners on Health Resources. Yes, the Mass Free Health sponsored by Total, I had facilitated that program since 2014. In 2014, Partners on Health Resources facilitated it. Then in 2015 and 16, an NGO, Community Empowerment and Development Foundation, facilitated it. Then this last one was done by Manifield, Nigeria. But I was the sole facilitator of all these programs in these years. Thank you.
Yeah, how do you look at the programs? Are you satisfied with the health policy of Total E&P as it concerns their host communities?
Yes, I am very, very satisfied with the health policy of Total E&P Nigeria Limited. I have been following up the company concerning their health policies. They have robust health programs that aim to help in improving the healthcare delivery and the health status of their host communities. You know, apart from the mass free health that they sponsor every year, they have other public health programs like the drug donation to the health facilities in their host communities. They do this every year. They also have health awareness program, especially on HIV/AIDS, on malaria, on TB, and other chronic diseases. They do this every year. And they also have programs like Safe Motherhood program and others. So these health programs have helped in improving the health situation of their host communities.
All right. In this recent program that was just held, the Mass Free Health program, held OMN 58, what were your challenges in executing that project?
Yes, thank you very much. This year is the first year we had 2-week program. The other years we have been holding the program for 1 week. Okay. And we have gained experience over the years on how to conduct this program. But this year, because it's a 2-week program, it was quite difficult to get healthcare workers, pull them out from their primary point of work to work outside their primary point of duty for 2 weeks. So that was a challenge. But what we did was that we staggered the participation. We ensure at the onset, we ensure that the healthcare workers, they indicate the days that they will be available within these 2 weeks. So we use that to do a roster, and that helped us to conduct the program successfully concerning personnel. Then the other thing is that because the program was for 2 weeks, the attendance was enormous, because each day the number continued increasing. You know, ordinarily you would think that as the day goes, the attendance will reduce, no? But the attendance was increasing. And our budget for drugs, in fact, we overshoot our budget for drugs, because as the attendance was increasing, we were providing more drugs. Then the other is that the community volunteers we had, you know, they worked for 2 weeks, and they thought that they were working for the oil company. So most of them were expecting a fortune at the end of the program. So unfortunately, they were disappointed when the stipends were paid. But we made them to understand that it is a voluntary program. It's a voluntary service they render, that we are not really paying for the services they render. So these are the some of the challenges we encountered, and we know that if we have another 2-week program, the services will be better rendered and the program will be better organized than what we have.
So what happened to those who are yet to benefit? Because from what you said,
yes,
as the days go by, the number increases.
Yes.
Now, on the 19th of May, the program ended.
Yes.
Now, between 20th and now, there are a lot of people who sought to be attended to, but could not because of the limited time. So what happened to these people?
Yes, you know that in programs like this, it's difficult to attend to everybody. Very, very difficult to attend to everybody. So as they come, we ensure that we admit into the program, we register into the program on daily basis as much as we can attend. We were attending to close to 800 persons in a day, you know. We were attending to about 800 persons in a day, and we did about 20 surgeries or thereabout in a day. Okay, so the persons that we have not attended to, I believe they are going to benefit in subsequent programs. But there was one thing we did. There's what we call triage in medicine, where we look at the patients who come to the clinic, and we use our eyes to assess the critical ones, and we ensure that we attend to those critical ones first. So we did triaging in that program. Healthcare workers, the doctors, the nurses, they go out, look around and see the severely ill. We bring these people in, register them and attend to them. But the others that were not critically ill and had no opportunity to be attended to, I think in subsequent programs they will do that. Then in the surgery, we registered as many as possible, but unfortunately few of them were not attended to, because you know, when some persons, when they come day 1, they come day 2, they were not attended to, they stay back at home. Yeah, they stay back at home. But those who continue coming, we attended to all, because we even had an extra day to mop up all the surgical cases we screened and registered for the program. Okay. We attended to all of them.
Now, in the categories, how can you assess maybe how many ophthalmological cases, surgery, pediatrics, and all that? What are these? How do you attend to these people?
Yes, in the just concluded program, we registered and attended to 5,800 persons. These are the number that registered. Then of these 5,800 persons, children, the pediatric cases were 2,105.
Wonderful.
2,105. Now, the 5,800, all of them, they registered, they had their vital signs done. Vital signs, I mean, after the registration, the nurses, they did their BP, did their temperature, did their pulse, and also their weight. And after that, the nurses took their cards to the doctors, who now collect or speak to these patients to know what their health challenges are. So at this point, the doctors sieve out those who need surgical operation. You know, those ones were sieved out and also re-evaluated by a senior doctor to ensure that the diagnosis is correct, to also ensure that the problem they have can be handled by the program. So we did 215 surgeries. These 215 surgeries include hernias. We also did 2 emergency appendectomies. We did 2 emergency cesarean sections. We also removed some lumps in the breast, in the back, hand, and all that. We call that lipomas. We did many of that. We have an optometrist, 2 optometrists who attended to people with eye conditions. So those with eye conditions, we refer them to the optometrist. The optometrist, they attended to 1,806 persons, and 1,200 reading glasses were dispensed by the optometrist. And there is one important thing there in the eye clinic of the program. Most of their patients had cataract, but the program we had did not include cataract surgeries. And I think in subsequent programs, we are planning to include cataract surgeries so that the host communities will benefit from that.
Okay. Now, were there some referrals, maybe?
Yes, we did referrals, especially the one we call irreducible hernia. Okay. So those type of hernias, we can't do it in such programs. So we refer them to the general hospitals and teaching hospitals. Okay. Then some of the referrals we did the cataract cases, which we couldn't do them. We refer them to the University of Port Harcourt Teaching Hospital. Okay. Some other referrals we did was the issues of fibroids, because this program we do not include fibroids. Yes, the previous ones we did quite some fibroid surgeries, but this one we did not. So we also refer those ones out. The other referrals we did, the HIV positive. There are some people who don't know their HIV status. They were all screened and they were able to know their HIV status. They were cancelled and referred to the HIV treatment centers close to them.
Okay.
Yes.
Now, at this point now, who bear the costs of those referrals?
Yes. In medical treatment, making a diagnosis is part of the management in a medical condition.
Yeah.
Some of these persons, they don't know the problem, they don't know the type of problem they have, they don't know where they can get help. So in that program, they were able to see a doctor free of charge, and the doctor counseled them free of charge. Then the doctor made appropriate referral free of charge. So these things were done, and they benefited from this program for making diagnosis for them and making the referrals. And I think those who hold their health and life dear to themselves, they will complete the referral, go to the referral centers, and ensure that they are treated. So they will bear the cost themselves.
Okay. Well, this is okay, and we quite appreciate. I believe Total will also appreciate the work of Manifield Medical. But we go on a short break now. When we come back, we go back to our discussion segment. Stay tuned. Welcome back to the discussion segment of CSR Digest. I have with me the facilitator of the program that just ended, Mass Free Health Program that just ended some few days ago by Total EMP, Dr. Akubike Okara. Dr. Akubike Okara, once more you are welcome to the program.
Thank you.
Well, in this regard, you've analyzed the issues or everything that transpired within the Mass Free Health Program organized by Total EMP. Now, in your own personal capacity as a medical doctor, what is your advice to the people of UML 58 hosts and neighboring communities? What do you advise them health-wise?
Thank you.
Yeah.
I've done so many health programs in UML 58 communities. My experience with them is that most of them don't take health care very seriously, and that is the reason why in the last program we had health education as part of the services we render. And one of the topics we spoke on during that health education program was good health seeking behavior. We were able to tell them how important health is. That health is wealth. Health is everything. If you are not healthy, you won't be able to do your normal daily chores and daily activities. So my advice to them is that the people of UML 58 should have good health-seeking behaviors. They should go to hospital. There are so many hospitals. There are private hospitals, health centers. Currently, the only general hospital in Gilland has been closed because of insurgency, but I know that in no distant time the government will reopen the hospital. They should see the doctor regularly, eat well, exercise well.
don't you think that poverty is part of the problem?
Yes, poverty is part of the problem, but ignorance is even number one.
Okay.
Poverty, yes, because some patients I saw during the last monthly health, when I asked, why did you keep such health condition for so long? They said, doctor, there's no money.
Okay.
There's no money. But have you been to the hospital to know how much this thing will cost? Most of them have not been to the hospital. So they feel that they are going to part with a fortune to get treated.
Okay.
So ignorance is even the major thing.
Okay.
But if they have good knowledge of about health and how to seek good health, I think poverty will come down the ladder.
Okay, at this point now, do you think that all the health awareness campaigns carried out by Total EMP has any effect on the citizenry, especially in OMI 58?
Yes, it has little effect. It has little effect.
But what I'm asking is that even up till now, a lot of people don't even sleep under mosquito-treated nets.
Yeah, that is the ignorance I'm talking about.
Okay.
Yes, these services are brought to them free of charge by Total. Health awareness program. But when they attend these health awareness programs, some of them look at it as, or look at those programs as a jamboree. Yes, they look at them as a jamboree. So they don't take home the import of those programs. My advice to Total is that these programs, they need to be, the program need to be enlarged. The program need to be enlarged. Some of these programs that are 1 day can be increased from 1 day to 2 day program. Some can even be a day program. And I think what will benefit the people most will even what I call a health fair. A health fair where different health organizations, different vendors of health consumables,
okay,
where we will bring them together for a period of about 3 to 5 days, so that they talk to the people, demonstrate this thing to them over a period of 4 to 5 days, instead of having just a 1 day lecture program. Yes. So this will drive home the message, so that these people, they will be aware and we know the importance of seeking good health.
All right, this is good. That advice is laudable. We hope that the management of Total EMP will take it seriously, because I think it's one thing to do a health awareness campaign, it's another to also follow up to see this. But with the feedback mechanism of Total, the little they can do you think, or are you optimistic that in the nearest future the host and neighboring communities will catch in, or will key into the health policies of Total to benefit themselves health-wise? Do you think so?
Yes. If these programs are intensified, I think the host communities, they will catch in. The host communities will catch in. Because the Bible says that faith cometh by hearing. And I think if they continue hearing these health messages, faith on health will come.
All right, one more word for the two parties, Total EMP and the host community. Can you just wrap it up?
Yes, I want to thank Total EMP Nigeria Limited for their numerous health programs. The programs, in a way, has helped the people. I don't know the health condition, what the health condition of the people would have been without those health programs. But I advise them to do more. because when they intensify these health programs, the people who have not been listening, I believe they will listen, and the ignorance will be washed away, and their health condition will improve. For the people, they shouldn't, the OML 58 communities, they should not look at these health programs as jamboree. They should take them very seriously. They should take them very seriously. And if they are giving any health consumable, like the mosquito nets, they should use these mosquito nets correctly. And if they do that, malaria will be a thing of the past in that community. Thank you.
All right, thank you so much, Dr. A.U. Akara, for appearing on this program, CSR Digest. I believe CSR Digest will come your way again next week, God willing, with another interesting package. Until then, I have to say bye.